Okay. Hello, everyone. My name is Sarah Kirkendall, and I'm a practice manager within the IDD division here at Integral Care, which is the local IDD authority in Travis County. And I'm here with my coworker, Jesus.
Hello, everyone. I'm also another practice manager at Integral Care in the IDD division.
Awesome. We are here today to talk to you about IDD services through your local IDD authority. Every county and every region has their own agency that they'll work with. So, Integral Care is the agency here in Travis County, and we'll have additional information that we can share at the end about how to find your local IDD authority. But we're going to go through kind of start to finish how to connect with your local IDD authority and how to go through the intake process and enroll into services. And Jesus will kick us off.
Yeah, so like Sarah was mentioning, we are the local authority that services Travis County, but there are local authorities throughout the state of Texas, each serving a certain area. Ours is Travis County. Now, the information that we will provide um, is specific to our agency, but it's mirrored across all the local authorities. It's very similar, so very applicable. What you hear here is the agenda. We'll do introductions. We'll define intellectual and developmental disabilities. We'll talk a little bit about the intake process and then the IDD services that we help manage. Okay, so again, we service Travis County. Hill Country MHDD is a local authority for south of Travis County. And then north of us, you will find the lit up Blue Bonnet that services the area above, north of Travis County. So what does Integral Care or lit up like us do? We help with eligibility determination for intellectual and developmental disabilities. We provide service coordination for IDD services, including waiver and non-waiver, which we'll explain a little bit more further on in the presentation. We maintain the interest list for two Medicaid waiver programs. There's multiple, but two of them we help maintain, which is Texas Home Living and Home and Community-Based Services. We provide crisis prevention services for people with IDD. And then we support individuals who may be transitioning from an institutional setting to the community. And when I say institutional setting, things like nursing facilities or state supported living centers, which we'll talk a little bit more down in the presentation. We'll go to the next slide. So eligibility determination. Like I mentioned, I don't know if you've noticed, I mentioned intellectual and developmental disabilities. It's two sides to that. So our intellectual disability, the determination for that, it's looking for an IQ of 69 or below. And that's presenting difficulty with reasoning, abilities, problem solving, judgment, planning, academic learning, and experience. Then that determination is also looking for deficits in adaptive functioning. So things like communication, social participation, and independent living. And there's likely to have these problems to be across multiple environments, home, schools, and work. And the onset for this determination for specifically for intellectual disability is prior to the age of 18. So when testing occurs, it's looking for these three things: the IQ, the deficits in adaptive functioning, and that it onsets prior to the age of 18. We can move on to the next slide. Now, the other diagnosis is developmental disability. And you'll see on this slide a list. There's a multitude of developmental disabilities. But here are just a few. Autism is one that falls within cerebral palsy, hearing loss, Tourette syndrome, vision impairment. Now, with these developmental disabilities, what testing is looking at is that it's coupled with an IQ below 75, plus that the onset, so when the diagnosis is given, is prior to the age of 22 years old. We can move on to the next slide. So, our intake process to schedule an IDD intake, so an intake with the IDD division within integral care, a person would call our helpline or our hotline and request specifically an IDD intake appointment. There's multiple divisions within integral care. We also provide behavioral health services. So because there's multiple divisions, it's important that it's specified that an IDD intake appointment is wanted, needed. Now, prior and during the intake, there's a gathering of records and documentation. Specifically, it's very important that that preparation occurs prior to the first intake appointment. It is our intake process is separated into multiple appointments, but to be able to proceed past the first one, it's really important that that documentation is prepared prior. When the day comes for the first intake appointment, one of our service coordinators within the intake team will meet with an individual and or family involved or involved parties and go over programs, services, consent paperwork, and the documentation that was gathered to see if we could proceed on to the next part of the intake process. If we have the documentation that's needed and we're able to obtain the signatures that are required to proceed, then the next step would be scheduling an intellectual determination of intellectual and disability appointment. Okay, we can move on to the next slide. So again, just to go a little bit more in depth with the first intake appointment, here's a little bit of what to expect. We'll complete forms about the individual, the health and finances. Documents will be signed that will allow integral care to be able to provide care. We'll obtain copies of clinical records and things like a physician attestation, which can come from the individual's primary care doctor. And once all of this is completed, it's what will allow us to be able to again move forward, to be able to proceed with testing, what is also referred to as a DID or determination of intellectual disability. And that testing is completed by our psychologist testers that we have within our division. We can proceed to the next. Now, what to bring? I know I mentioned, kind of an idea of what's completed during the appointment. But here's a list of important things to bring. We need 2 forms of identification, proof of address, insurance, and income. And again, I emphasize medical history paperwork about mental health, psychological, or IQ testing. That's really important for our testing. List of medicines that are taken. And if there is a legal guardian, then we also need proof of that legal guardianship and photo identification. We can proceed to the next slide.
All right. Before we move to a bit more information about the testing appointment, I just wanted to reiterate what Jesus mentioned earlier, that this is the process for anybody whose home base, their home, is in Travis County. And so the hotline number that we listed in this presentation will be for those living in Travis County. I will be sharing, and that will be included with this PowerPoint and presentation, all the local authorities across the state of Texas and how to reach out to them directly, including which counties that they cover. So you'll be able to have a lot of good information for how to find out where your local authority is. Even though your loved one is here in Travis County, the LIDA that is responsible for eligibility determination is wherever the home is, the primary residence. And so that's why we want to make sure to include that list of all the local authorities across the state. Some local authorities are going to serve one county, like Integral Care. Also, the Harris Center out in Houston only services folks that live in Harris County. And then some local authorities are going to serve multiple counties. I believe Hill Country MHDD, which is to the south and west of us, they serve 19 counties. And so when you look at that list, it's going to be important to find your county and then see which local authority is yours. Okay, so we'll get on to the actual testing appointment. So, in the state of Texas, in order to be found eligible for intellectual and developmental disability services that are state and federally funded, including those funded through Medicaid, individuals have to come through a local authority and see our psychological staff. Psychologists, so PhD level psychologists or licensed psychological associates, must be employed or contracted with a local authority and certified as an authorized provider with HHSC in order to determine eligibility. And so that means if you've gotten testing through the school district or through a medical provider or through another private psychiatrist or psychologist, that's great. We want those records. We need to see those records, but it doesn't automatically mean that you're eligible for services. So you still have to come through and see our psychologists. And I'll talk a little bit about the records that we need to support eligibility determination based on diagnosis. The determination of intellectual disability and related conditions is kind of the full name, but you might also see it called the DID, or determination of intellectual disability. And prior to, I want to say 2013, you might also see it labeled as DMR because it's using outdated language for intellectual disability that we don't use anymore. And I say that just to, so you know, because sometimes families are like, I think I went through my local authority already, but I'm not sure. And so if you've got paperwork, that will be a helpful way to know if you've already completed that eligibility testing. The other important thing to know about the determination of intellectual disability, the DID testing, is that it is strictly for eligibility determination for IDD services. We can determine if somebody has an intellectual disability. We can help determine if somebody has an autism disability, but all of that is through the lens of eligibility determination. And sometimes that doesn't always line up perfectly. I also say that to say that if somebody is needing testing for, say, ABA therapy through Medicaid, the determination of intellectual disability does not provide what is usually needed. It is really strictly for determining what services somebody is eligible for that are state and federally funded. So the DID assessment includes interview and observation of the individual. They're going to do their own IQ testing and adaptive functioning testing. We like to have all the records so that we make sure we're not duplicating testing if it's not needed, but we do still have to generally do even if it's an abbreviated version. And we're going to review, and the psychologist is going to review all available records and documents that support that this person has this diagnosis, the age of onset, and the eligibility determination. So the determination of intellectual disability report, that's that final report that summarizes all the testing that was done and all the records that were reviewed and formalizes a diagnosis based on eligibility determination. It's going to include important information about the person's IQ, adaptive behavioral level, and the services that they may be eligible for based on their diagnosis. We always like to caveat with may, because being eligible doesn't mean that you're eligible for all services. Each service package has its own eligibility criteria, and we'll talk a little bit about that in a second. Okay, if you are seeking services based on an intellectual disability, so intellectual disability, if you remember from earlier, is an IQ of 69 and below, deficits in adaptive functioning, and the age of onset prior to 18. And that really means 17 years the day before your 18th birthday. It does not necessarily mean that you were diagnosed prior to 18, but there was evidence that the diagnosis was present during that time. But generally speaking, folks have been diagnosed with an intellectual disability either from their school, from a private psychologist, from a neurologist, and we need all of those records. We especially need those records once somebody turns 18 and the further away from 18 that they get, because we still need to be able to establish that the onset was prior to 18. That's a pretty strict requirement that the state has. So here are some copies of evaluations that are helpful. I think for you all, really, if you have the full and individual evaluation or the FIE from your school district, that is usually perfect. Our paperwork is helpful if it includes diagnostic information, but really we're looking for IQ scores, adaptive functioning levels, all of that to really confirm, and then age of onset when testing occurred so that we can confirm the diagnosis. It's not impossible to diagnose intellectual disability without these records. It's just very, very difficult. And your intake coordinator, regardless of the local authority that you are connected to, is going to help you and hold your hand through this and help you gather the records, help you request the records so that you can be well prepared for that testing appointment. If you are seeking eligibility based on a developmental disability, so that is, if you remember that list of diagnoses that Jesus showed, plus a lot more. There's a couple hundred that the state recognizes, and the diagnosis has to be on that list. The age of onset is prior to 22, and we'll also do the IQ testing to confirm that the IQ is within the eligibility range. We also call developmental disabilities related conditions, just because we don't ever keep things very simple and streamlined. But if you hear related condition no for IDD services, that's the same thing as a developmental disability. Now, certain developmental disabilities may be technically a developmental disability, but not listed in the list of diagnoses that the state recognizes. One example of that might be a speech delay, might also be ADHD. Even though these things are diagnoses that occur during the developmental period, they're not considered a service eligibility related condition. State and federal rule requires that for related conditions for several services that we have a physician's letter or document signed by a physician that officially diagnoses the person. One reason for that is that many of the developmental disabilities or related conditions are medically based. So only a medical provider is able to provide that diagnosis. And then our psychologists endorse that diagnosis. We are able to diagnose autism. Our psychologists are able to do that. But for enrollment into services, state and federal rule combines autism with those medical diagnoses. So, a lot of times, what your intake coordinator is going to do is help you get that letter from your physician. And we at Integral Care, we are happy to share if you feel like you need it, a letter to share with the physician that says exactly what we need. We need the diagnosis clearly written. We need the ICD-10 code, age of onset, and that's not the age that necessarily that the diagnosis was given or that when the physician started treating the individual. It's really when did this set of symptoms start for this person to the best of the medical provider's ability to determine. And the reason for that is because we have to make sure that the age of onset is prior to 22 years old. And then we need the physician's name and their signature. Okay. So now we'll start talking about the services that you might be found eligible for. Um, and these are integral cares services, but they are very similar across the state with other local IDD authorities. There might be a little difference and variation, but these are the main ones that just about every local authority is going to provide. So, like Jesus mentioned, we are responsible for adding people to the statewide waiver interest list for Texas Home Living and home and community based services. And so, this is a really important one, and I'm really happy that we're having this presentation because the sooner that you can connect with your local authority, the better. And we also recognize that historically there's been a little bit of siloing of services where folks really focus on school and academic until their kiddo turns 18, and then it's a scramble to connect to the local authority. So if you're at 18 right now or your loved one is, that's okay. It's not too late. But if your loved one is younger than that, 5, 6, 7, 3, this is a really good time to go ahead and call your local authority and get your loved one on the interest list. The statewide interest list is large and very long. Right now, we are seeing folks come off the home and community based interest list who were put on in 2008, 2009, 2010. So if you do the quick math on that, that's about 15 years to wait for those services. And so the sooner that you can connect, the better. But it's never, ever too late. And if your loved one is in real crisis and at risk of losing placement, housing, caregiver, your local authority can help you navigate that and see if you can kind of move up. But the sooner you can get on these lists, the better. Now, you don't necessarily have to complete an intake and go through the whole testing in order to get on the interest list. You really can just call your local authority and ask to be placed on it. Now, what will happen then is in 15 years, when your name comes up, then we'll determine if you are eligible for services. And that's where things can get tricky if you haven't saved all those records and your loved one is now in their 30s. And so I have a handout that will also be sharing. It's specific to integral care, but it can be used for all the local authorities. Our recommendation is even if you don't want to do the intake, send us all those records. Share them with us and we'll save them for whenever your name does come up. And unfortunately, it will be on the family to save those records. Schools don't always save the records past 5 or 7 years. And so I always recommend put them all in a binder, email them to your local authority, and put them in a fire safe box. That way, when your loved one comes up on that list, there's no questioning eligibility. All right. So, most local authorities are also going to provide what are called non waiver and waiver programs. And I'm just going to kind of hover here for a second because we'll go into more depth in a second. Non waiver, generally speaking, there is no wait. You are able to access those services as soon as you are found eligible for them. The waiver programs, there isn't it that these are the ones that are the interest list. And then most local authorities are going to provide some version of crisis prevention support to people diagnosed with intellectual and developmental disabilities. All right. So, service coordination is the primary service that most local authorities are going to provide. Every program that a local authority, every service that a local authority provides, they also provide the service coordination for, and primarily the service coordination. A lot of these services are actually provided by private community based providers who are required by rule and law to coordinate and collaborate with the local authority. So the service coordinator is going to make sure that the services in your program are happening, that you are happy with them, and that they are helping you reach the goals that you want for yourself. And if at any time those services are not, your service coordinator is going to help you work with your provider to change those services, to add services, to increase services. So your service coordinator really helps you navigate the program that you're enrolled in and make sure that you are getting the most out of it and that your wants and needs are being met. Okay, we'll go into a little bit about each program's eligibility and then also the services that they provide. Um, because a lot of times there's a lot of overlap, I'm going to focus on what's different mainly in these services. So, general revenue is a state funded program. You are not required to have Medicaid to get general revenue services, but that may mean that your income is used to determine ability to pay. And private insurance may also be used. For general revenue, the diagnoses that a person must have to access those services are very narrow. Somebody must have an intellectual disability, so an IQ of 69 and below prior to the age of 18. and or autism spectrum disorder. For general revenue, even though, so the only related condition that accesses this service is autism spectrum, but there's not an IQ requirement connected. This is our smallest package, and it only really provides service coordination. Um, a lot of families who are still have kids in school, who are maybe accessing other non-state and federally funded services may use general revenue to kind of navigate all of those. So, especially for kiddos still in school, we'll include academic services onto the treatment plan and we'll monitor those and we'll help the family navigate if need be. The other big service that general revenue provides is planned respite, which is in-home care for the kiddo so that the caregiver can rest or take care of other needs to attend to other kiddos. Um, Respite is for the caregiver. And so it's an opportunity to engage the individual in community integration and activities that the person really enjoys, but also to let the caregiver get a rest. And so this is important for caregivers with minor children and also caregivers with adult children with intellectual disability and autism. The next one is Community First Choice. This is another program where there is no wait for this service. As long as you have the diagnosis and you have Medicaid, you can access them. Um, this does include all related conditions, not just autism, but the individual must have an IQ of 75 or below or an LOC of 8, which means really intensive care needs. So this also provides service coordination, but the main service is attended care that is designed to help the individual build and maintain skills to take care of themselves. So the waiver programs, Texas Home Living and Home and Community Based Services, both of these require Medicaid. Both of these require that the individual have an intellectual disability or a related condition plus an IQ of 75 or below. The services provided in Texas Home Living and HCS are pretty similar. The main difference is that HCS provides residential services. So somebody in the HCS program can access a group home that is staffed with professionals who are on site 24/7. It can be a host home situation, which could be mom or dad getting paid as the host home provider to take care of their loved one. Or it could be an individual that is contracted with a provider to provide host home services to a non-family member. And oftentimes in that situation, the individual will live with a few other individuals who are also in the program, and the host home provider will provide for those their care. And then there's also own home, family home. So somebody can live in their own home or in a family home and still receive these services. The services just go to that home. We have folks in HCS who live in apartments by themselves and have care that come in to help make sure that bills are paid, their medications are taken, meals are prepped, but otherwise they live very independently. And then we have a lot of family individuals, adult individuals who live with family members and have these services to help. Both of these are the ones that have the long wait list, interest list. The state refers to it as an interest list. So these are the ones that are the most robust services, but have the longest wait. So I really encourage after you have watched this presentation that you go ahead and give your local authority a call. Make sure that you're on the list. You can even ask where your name is on the list or where your loved one's name is. Or you can go ahead and get on the list right now. So these are the really important services. They're all very important, but these are the ones that really require kind of activating and getting engaged early on. So at Integral Care, these are the crisis prevention services that we provide for individuals with IDD. A lot of these services, you don't necessarily have to have been confirmed by our psychologist in order to receive them. And the reason for that is oftentimes people are in crisis because they don't have the services that they need. And so a big part of our job with these services is to help navigate that intake process. Most of these services are not going to be, they don't replace 911 or emergency services. A lot of times the funding for these teams is only enough for one or two staff. For Travis County, that's not too terrible because we just have one county. But like I said, for Hill Country, they have 19. So it's not necessarily in the moment support, but rather support that can happen just before a crisis, in the middle of a crisis, or just after, with the focus on preventing future crises and helping resolve the one that is happening right now. All right. And then if you are in the Travis County area, um, and that's for anybody, if you are in Travis County, our IDD crisis prevention services can help. We provide services, crisis prevention services to anybody that is physically here. So even if your home base LIDA is someplace else, if you need our help while you're here in Travis County, we can assist. And Melanie Babbitt, this is her contact information. And so please don't hesitate to reach out. If you or your loved one is experiencing imminent danger, then you'll need to call 911, request a mental health officer. If it's not in imminent danger, but you need more immediate support, then you can call your local authorities hotline and ask for the mobile crisis outreach team. But if you're needing help that needs kind of beyond the moment to prevent future crises, our services can definitely help. And that's important it is to know who your local authority is, how to reach out to them, and how to at least get you or your loved one's name on these waiver interest lists, or how to go through their intake process. I mentioned earlier that not everybody knows who their local authority is. It's not always common knowledge that services don't continue automatically after graduation, which is why we're so happy to be able to do this presentation and to share this information.
Do you have to contact your local authority to keep your name on the waiting list? Do you have to contact them every year?
We encourage you to, but your local authority is responsible for reaching out to you every 2 years. The main reason why you want to stay in contact is so that we have your name, we have your phone number and your address that is up to date. What is really heartbreaking is to have somebody's name finally come to the top of the list, but we were never able to continue to make contact with them, and they've moved, and then we have to give the slot back. And so that's really the reason why it's important to reach out to. We always sometimes tell families, reach out on your loved one's birthday every year and just do the contact. You don't have to. It is our responsibility to reach out. But if you move, you change phone numbers, let us know, because we want to be able to reach you when it's finally your turn. And so you can get these important services. But the important thing to know is, even if we miss each other and you don't always call and we aren't always able to talk, you're not taken off the list.
Okay, thank you so much for coming today and sharing this important information with us. It is very helpful. If you have any questions, or how would we get in touch with you?
I will share with Bianca this PowerPoint and include a slide that has my information and Jesus's, as well as our other practice managers here at Integral Care. Even if we are not your local authority, you are welcome to reach out to us with questions. We have connections with most all of the agencies and can put you in the right direction if we need to.
Wonderful. Thank you so much. This has been very helpful. I really appreciate the work you do. Thank you.